Conflicts occur within each person every day. Although one might be unaware of the enemy, it is war just the same. Cells are an army, fearlessly shielding one's body from foreign invaders. Located within bone marrow, billions of white blood cells generate an immune response, eradicating pathogens upon detection. Prior to the 19th century, large groups of the human populace arrived at an untimely death due to unidentified infections brought upon by pure ignorance. Unlike his colleagues, Joseph Lister sought to comprehend and avert the forces causing humans to fall ill. With research, experimentation, and assistance from the findings of Louis Pasteur, Dr. Lister would not only combat microscopic germs within the human body, but also gain acceptance of his theories from stubborn, higher-level medical colleagues. Within the heart of uptown Essex, England, on April 5th of 1827, Joseph Lister was born into the world. A devout family, the Listers guided their son through Quaker schools in London and Hertfordshire, both of which centered their curriculums on science. While this intense form of schooling surely sparked an affection towards the sciences for juvenile Lister, his own father, Joseph Jackson, was his biggest motivation. An up-and-coming experimental scientist, Joseph Jackson was commended for the invention of the achromatic microscope lens, which did not distort the color of the sample subject. Because of the plethora of accomplishments Joseph Jackson had attained, his son had a driving force within him to become everything his father was, and more. After realizing that the field of science captivated him most, Lister chose to continue his education at the University of London, earning a bachelor's degree in the arts. Joseph then narrowed down his career path in the sciences by dedicating himself to the medical program at the university. Although Lister adored learning in the classroom environment, his true passion was research, and therefore he often concluded a full day of study with a period of time at the microscope. In the midst of his hectic lifestyle, Lister had the opportunity to witness the first surgical procedure with assistance from an anesthetic in 1846. At the time, quote, "If a patient did not die from the pain of an operation, there was a good chance that he or she would succumb to the ensuing infection instead." Quote. Dr. Lister was advised soon after to acquaint himself with James Syme, the professor of clinical surgery in Edinburgh. Humbly working his way through the ranks, Lister was first Syme's dresser, then his house surgeon, and eventually his son-in-law, after marrying his eldest daughter, Agnes. In order to begin a new life with his wife, Lister had to locate a source of income, instead of relying on the money he was given by Agnes's father. So Joseph Lister and his small family moved to Glasgow in 1860, where he received the title Professor of Surgery at the university, and later obtained privileges within the Glasgow Royal Infirmary. Although Lister had a well-paying job as a professor, the teaching aspect was not necessarily as fulfilling as he had hoped. In a flash of pure coincidence, possibly fate, one of Lister's fellow colleagues, Thomas Anderson, recommended to Lister a paper of Louis Pasteur's findings that Anderson himself had read. The experiments Pasteur described within the collection sparked the entrance of Lister, as he drew a correlation between the studies of fermentation and his persistent questioning about infection within wounds. As a result of Pasteur's observations, Dr. Lister was driven to similar relentless experimentation. Pasteur had concluded that germs were disseminated throughout the air, disproving the established notion that fermentation resulted from a chemical reaction with the atmosphere. Establishing the germ theory, Pasteur acknowledged the role of airborne germs, which was to initiate fermentation and growth upon yeast. Although his work in the field of fermentation was not especially celebrated, Pasteur's detailed journals and experiments acted as a catalyst for Lister, contributing to the safeguard of millions of lives in the future. In order to ascertain whether the same germs in the air that brought about fermentation would also instigate infection within wounds, Lister began to perform comparable experiments to those of Pasteur. To commence his explorative journey, Lister boiled urine and divided the sample into two trials, dispensing half into a flask with a straight neck, and the latter into a flask with a bent neck. Upon removal of the flask coverings that kept the contents secluded from outside forces, the contaminated air immediately decomposed the sample in the straight-necked container, while the urine in the curved-necked flask remained unaltered. While the findings of Pasteur assisted Lister only in realizing the source of this suppuration, they also gave Lister reason to assume that the exposed entrances of the wounds heightened the risk of infection. Fermentation did not transpire due to a reaction between a solution and the air. Rather, it occurred because of a reaction between a solution and something within the air. This reasoning led Lister to consider that an airborne pathogen inputted itself into an opened wound, preventing successful clotting and scabbing, and instead triggering the decay of the flesh. As soon as Lister fully acknowledged the function of germs and their capability, he began exploring possibilities that would either eradicate the pests from the air or avert them from passing into wounds. Quote, "You must be able to see with your mental eye the septic ferments as distinctly as we see flies and other insects with the corporeal eye. If you can, you will be properly on your guard against them." Quote. Granted that Lister discerned means by which germs could enter the body, he could then prohibit the microbes by, quote, "applying as a dressing some material capable of destroying the life of the floating particles." Quote. The application of dressings was only effective to a certain extent, however. So, Lister next pursued to wipe out germs themselves. Initially, he tested whether heat would prove a substantial force in suffocating the specimens. Although this did work, Lister abandoned the method because the amount of heat required would have burned human flesh. Persevering despite initial failure, Dr. Lister pondered whether some sort of chemical could be beneficial in the purifying process. Lister found himself reading an article on the cleansing effects of carbolic acid on sewage and entozoan, a parasite thriving off of cows. Lister considered that carbolic acid would conclude his search. Lister utilized carbolic acid primarily by soaking dressings before proceeding to wrap wounds. Unfortunately, at the time, countless medical professionals treated patients with grimy hands and tools. Therefore, this did nothing to fix the dilemma. Doctors did not see the need to wear protective masks and gowns, thereby directly spreading their own germs to patients. To combat this preventable suffering, Lister encouraged the medical community to sterilize their hands and instruments with carbolic spray, which he introduced in 1867 by developing a machine to pump the acid. Lister was met with resistance by his contemporaries, who were not using the methods properly. For example, individuals claimed that carbolic spray was ineffective after cleansing instruments only once, accidentally dropping them on the floor, and later piercing their patients with unsterilized tools. Therefore, Dr. Lister proceeded to publish the effective results of his experiments in the Lancelot within the year of 1867, silencing his critics. The statistics spoke for themselves. The exceedingly high death rate of 45.7% drastically shrunk to 15% with the continuance of the Listerian methods. Widespread acceptance of Lister's procedures was rather slow, as is often the case with revolutionary new ideas. The antiseptic procedures were accepted in Edinburgh and brought about a surplus of success. Over a decade later, the countries of Denmark and Germany consented to the exercise of the Listerian principles, never again returning to previous methods. However, Lister's homeland of England was hesitant in executing his published theories. Yet, in 1879, the tables turned. With his newfound and glorified position as Professor of Surgery at King's College Hospital in London, Lister finally gained acceptance from his older colleagues, who grew not only to admit that they were in the wrong, but also to respect Lister and his discoveries. Dr. Joseph Lister proved to prevail in both of the wars he fought, conquering the effects germs had within wounds and overcoming the doubts of his medical colleagues.